non-ICU beds in use. Wanted to give some updates as we did move the briefing for Tuesday based on Thanksgiving this Thursday as well as other closures on Friday. So with that, in regards to testing, the Civic Center's testing site will be closed on Thursday in observance for Thanksgiving, while Heartland Health Services will be closed Thursday and Friday, but will be up and operational again at 9 a.m. on Saturday. We received a lot of calls regarding contact tracing as well as letters for returning to school or to work. The best phone number to reach staff anywhere, and that includes throughout the Tri-County and the state, is going to be the 312-777-1999 phone number. Again, that's 312-777-1999. I think to note about the contact tracing is, like many of our counties, we may not have your information, and that may be because it was not provided to us or is still being updated. So if we're unable to find you, please do call back. Give us about 48 hours, and then we can trace back to see what the issue was. It also might be that the individuals that you were in close contact with did not provide us that information. So we would also recognize that you should reach out directly to them to make sure that they were providing the health departments with that key information. We're also getting a lot of questions regarding enforcement. Again, when we brought this up, and our sheriff for Peoria County, Brian Asba, also spoke to it, we are doing a progressive enforcement procedure. We receive complaints through the Healthy HOI website, the Restore HOI website, at which point those complaints are logged in our system, and then based on that information, they're either provided education and follow-up, or either to the person that complained or to that location. Following that, we look at subsequent complaints that come in, and then it gets routed to the agency that is best equipped. Not all complaints are going to be handled by the health department because we may not be the regulatory agency involved. And so those, again, get directed to those agencies, whether they're state or local agencies, to follow up on. There's been a lot of focus on those individuals or those entities that are not doing, and we know that there are a handful out there that are not following the mitigation efforts. And, I think the sheriff said it best, there's a lot in play here, not only in terms of just the health and safety of our community, but them for a business as well. It puts their licenses and their regulations on the line, as well as the fact that a lot of funds have been made available through small business grants and likewise to help support entities. And by not following through, you're putting that funding also at jeopardy. But I would like to actually highlight on the positive. Here in Peoria County, I mentioned it last time, we started doing a COVID Excellence Award for our food establishments. And as of right now, we have over 200 nominations. And that's impressive, to think that there are over 200 individuals that have brought forward recognizing the great work of restaurants in our community. We plan to highlight those entities with our winner at the end of the year, but more importantly, if you visit the health department's Facebook page, you can see an ongoing list of those establishments, even the great things that people are saying. And I think that's the importance, is that majority of individuals are doing the right thing, and that's the narrative, and that's the conversation that we should be pushing forward. And then lastly, I wanted to just report quickly on our data. Based on the holiday starting here on Thursday, we will be submitting the data for Thursday, Friday, Saturday, and Sunday on that following Monday. So we won't be releasing any daily counts on Thursday and Friday. They'll all be put together on the counts on Monday. I would just like to take the opportunity, because we are going to Thanksgiving, to recognize all the great community partners that I am thankful for in this response. They have been just doing an amazing job, along with all the women and men and our frontline workers that have worked tirelessly since February in response to this. And then, of course, the public health staff. I don't know if many of you know this, but yesterday was Thank a Public Health Day. I think in terms of what's going on this year, it was appropriate to recognize that we have amazing public health staff, not only at this health department, but throughout the state. Some, and I can think of four specifically, that have been working since day one and continue to give everything now that we are 11 months into this response. And it's those amazing people that work tirelessly to help protect the safety and improve the health of our community that I am really proud to be a part of that team. And then lastly, I'm actually thankful for Peoria County. We have a great community here, and they are doing the right thing, and they really do care for their neighbors. And so while it is maybe easy this Thanksgiving to focus on what it looks different, we're not having great-grandparents over or aunts and uncles. I think it's important to also challenge each other to focus on what is actually good this year and what we really can be thankful for. So with that, I'll open up to questions.
My question would be about enforcement. I know the approach the whole time has been on education, not necessarily wanting to have to punish anybody for disobedience of the mitigations. But let me ask, I know there are some businesses out there that receive this education, just keep right on doing what they're doing anyway at the indoor service. So at this point, have you referred anybody to law enforcement or the state's attorney?
So in the progressive steps for enforcement, the first step is, of course, education. And then we move to a first notice. I do believe we have at least 2 establishments that are in first notice. I'm not sure. I think actually one of them has gone back and made drastic changes to what they've decided. But for the most part, you know, we, and that includes myself, the law enforcement and our state's attorneys are fully aware of our progressive enforcement procedure. And, you know, we are working through those processes. It is complaint driven, and, you know, one of the issues is always going to be limited resources. At the health department, we have limited resources. Our law enforcement partners have limited resources, and our state's attorney. And so that's going to be the #1 challenge as we get through it. So we are hearing those complaints. We are working through them. But sadly, you know, part of it is just we have to work through this in a prioritized fashion.
So at this time, it's 2 out of, I mean, just how many in general, even a rough number, have you had referred to you since this all began?
About 20. And now it has changed drastically, I think, with now the mitigation being much more broad. Before it was really focused on bars and restaurants, and now we're seeing, you know, other establishments including the list. But a majority of those, I think the education was actually brought back to the person that filed the complaint. It was recognizing the fact that they are allowed to be opened. They are having those protocols in place. Because remember, a lot of the executive order has been focused on the businesses. And we really can't go after individuals. So if you have a patron at a store that's not adhering to rules, it's not necessarily on that business. And that's the key thing to recognize the distinction.
Would you be able to name the 2 that are on first notice at this time?
Oh, I don't have that information. I just know from my staff updates.
In terms of Thanksgiving, if it were to become a super spreader event, like what would be the timeline for us to see the spiking numbers or be able to tell if Thanksgiving was a super spreader event?
So the question regarding if Thanksgiving was a super spreader, when would we see those numbers? You're going to start seeing them anywhere from day 4 after that to 28 days later. So really, we look at it in terms of incubation periods. So because the virus has an incubation period of 14 days, right after Thanksgiving, you're going to see that first incubation period of 14 days, and then you're going to see anyone that may have been asymptomatic or not get tested, and then continue to spread it to the next cycle or the next wave. So within 28 days, we should see the full impact of what Thanksgiving looks like. There's a great graphic on the health department Facebook page, and I think it was shared by other departments, is that the key thing to recognize is that when you get tested before you go, that only tells the status of how you are at that point in time. So for example, if I were to be exposed 2 days ago and I got tested today, it might still be too soon to have been tested. So I think that my negative results means that I'm clear to go for Thanksgiving. But during that Thanksgiving weekend, where my symptoms start developing, I can just start spreading it during that time period. And then, of course, that negative test really wasn't negative. And so really, the focus of this conversation is you get tested, you know, get yourself isolated, get yourself in quarantine, but there is no perfectly safe way. And the thing to recognize is that if you've been exposed, you really should be in quarantine and not going anywhere for Thanksgiving. Likewise, if you do get tested, understanding the risk that you're putting others in. It's just going to be a point-in-time test. So that's why, you know, my own family, we're just having a Thanksgiving with 4.
Moving up to, you know, Thanksgiving this time, I've heard a lot of people say, well, me and my family are going to get tested so many days before Christmas, so that way we can continue. You're talking about that point-in-time test. What would have to be the full, safe-proof way besides getting tested and then literally not going anywhere for 28 days?
So the question is, what is the safe proof or the best way to adhere to this? And there's nothing is zero risk. A lot of families are looking at things such as, I'm going to get tested and then do that self-isolation or stay-at-home order for 14 days or more, saying that we're going to go remote for everything, remote for work, remote for school. We're not going to any other activities. We're just staying in our own household. And that would make them, the people in their household, have a very minimum risk. But then the issue is that you're going to visit family and you don't know if they're doing the same. And so, again, it's looking at what your bubbles are. You can still control a lot in your own household, but that doesn't necessarily translate to the fact that others that are coming together for family events are doing the exact same. And they may not be able to. Their careers, their jobs may not allow them the flexibility of doing remote work for 14 days. And so again, it's going to be really difficult to have a risk-free holiday.
Monica, could you just explain a little bit the health department's role? I believe you entered into an MOU with District 150 on antigen testing, which they had passed last night. Can you talk a little bit about what that is and what your role in it is?
So antigen testing with District 150 is an exciting project that we're working on to get more testing capability throughout our community. One of the things that we're finding throughout the state is once people get tested and know their results, they're doing a great job self-isolating for 10 days. They understand that really well. And so with the antigen testing or this point-of-care testing, it provides results within 15 minutes. So you can identify people quickly and get them to isolate really quickly. So the goal of the antigen testing with Peoria Public Schools is that they're actually one of the schools that was selected to be a pilot program through the state, and it allows for them to have antigen testing available at different locations for their medical staff to be trained to administer the test. Now, not to get into all the details, but there is a license issue, and they have sought a waiver so that they would fall under that waiver. And then the health department would be working with them in terms of our standing orders. So Dr. Stoner, who has spoken a few times, of course, at this, is our medical director. So they would be operating under his standing orders to administer those tests. We'll be helping supply them with tests, but eventually they'll be getting a direct shipment from the state.
And how long does that pilot go before the state says it's a success, let's introduce it to other schools, maybe in Peoria County or elsewhere?
So right now, actually, a lot of schools have the option to do that. I think a lot of it has to do with staffing levels. Right now, we really want to make sure an individual with a medical background is able to perform the test, and that's not necessarily universal across all of our school districts. But for us, we're hoping that it's more of a pilot program for the full state. I think there is about 7, don't quote me on that, even I just said it in a press conference, but I believe there's about 7 school districts, including like Lake County has one, Winnebago, that are able to do this type of pilot program to show results. We're hoping that it can be extended even past whether or not the state says yes or no, using either the testing capabilities that we have, which right now are really directed to some of our first responder units, but hopefully that we can broaden this for them as well.
And this will be coming next January when kids come back to school in addition to all the testing Readiness is doing in conjunction with District 150.
Exactly, and one of the best parts about Peoria Public School District is they have in-school clinics that are available. Whether it's the Treewind Wraparound Center is a great example. That's a community-based clinic, and so they're being able to offer it even outside, maybe you can say normal school hours because of those type of strong partnerships that the Peoria Public Schools have.
I want to circle back to enforcement just a little bit. So once businesses get past that first notice, if they're still not really complying, would you guys issue cease and desist orders at all?
We would work through that process. So the question was, once we had the initial education, we're not seeing any improvements, what that process is. And yes, we would go through a first notice and then a second, and then eventually working with the state's attorney's office to do the cease and desist. But I think the key thing to recognize, though, is it's going to be, again, complaint-driven. So after we've done the education, and perhaps we don't hear another complaint for a while, we're going to assume that it has been addressed.
Are you hearing any issues with HIPAA and how it affects or could affect contact tracing?
In regards to HIPAA and contact tracing, we've always had to deal with that. Most individuals, and I would say about 80% or so, have been really upfront about telling us, oh, I've already contacted my contacts, they're expecting a call from you. when individuals don't feel comfortable talking to us or sharing that they were the positive to their close contacts, we inform them that the way we approach it would be, for example, that we would call somebody and say, rather than having a conversation of, oh, Monica Hendrickson recently tested positive and identified you as a close contact, we would say, you were identified as a close contact between the hours of 1 to 5 on Tuesday, November 24th. At this point in time, we'd like you to go into quarantine, etc. So we do have ways of making sure that we protect individuals' information so that's not shared.
But we've all probably received emails or calls from workers at businesses that saying they're concerned because the proper protocol is not being followed. And if that's from HIPAA or whatever, but are you seeing more of that?
I'm not seeing necessarily more of that. One of the concerns that we always see, though, is that people will post things on social media about their health status, and sometimes that gets shared across entities broadly. And so, again, one of those things is if you're posting it on your social media, be forewarned that your peers and coworkers will get that information.
In terms of Thanksgiving, in the event it becomes a super spreader event, to your knowledge, are hospitals doing anything to prepare for that possibility, or what would they be doing?
So the question about hospitals preparing for any increases in terms of hospitalizations regarding to Thanksgiving. And I would say that our hospital systems here monitor their ICU and their bed surge, their staffing, and even their supplies on an hourly basis. Because remember, your hospitalization data is going to be your lagging indicator, as we always call it, right? You're going to have cases first, then it's going to move into those that need hospitalizations, and then those that need intensive care. And so they're very much concerned, they're preparing, and they're monitoring, and they're adjusting their own schedules on a day-to-day basis to make sure that they're able to meet those requirements. But then I think that's a key thing to recognize, especially here in Peoria. Our hospital systems are not just an amazing resource that we have here, they're also one of our largest employers. So economically, they're a huge asset for our community. And the best way to thank our hospital systems and our healthcare workers this Thanksgiving holiday is to wear a mask, socially distance, practice that hygiene, and again, limit your gatherings as much as possible.
What is the percent of capacity left in our hospitals this week?
You know, I don't have that data, and I know it transitions really quickly. I only know their COVID values right now, which is just a percentage of theirs, but I would reach out to both of those public information officers.
I was just going to say, a lot of the hospitals have been asking for more people to donate that convalescent plasma. Maybe talk a little bit about how many patients you think may have been treated with that between both hospitals, and easiest way to donate or the best time to donate after. I mean, if it's been 2 months since I, have been cleared, is my plasma still good?
So the question about plasma donation, I don't know specifically how many have been given the plasma to date from our hospital systems, but there is one great way to donate. Both hospital systems have been working with Mississippi Valley, as well as University of Illinois College of Medicine does have a coordinator that's a point person to look over cases and reach out to individuals to have them enroll into the plasma donation. Overall, when we actually do contact tracing and we talk to people about their recovery, we actually share that information with them, give them a phone number to contact so that they can reach out if they're interested in donating. And usually it's at day 28 when your antibodies are at the highest. So we usually want to make sure we get them so that they're ready to be able to donate at that time period. Well, thank you everyone, and have a good Thanksgiving. We'll see you guys next Thursday.